This podcast is intended for axial spondyloarthritis patients and has been initiated and funded by UCB Pharma Limited. Information contained within this podcast is not intended to be a substitute for consultation with your healthcare professional.
So Sean, what are the symptoms that one sees in patients with axial spondyloarthritis?
Generally, the most common symptom that patients will come to clinic talking about is back pain. And generally, it's gradual in onset and it's often been present for some time, but will typically last for at least 3 months. And obviously this will depend upon when the patient's been diagnosed as to how long they've been experiencing these symptoms. But they can also be experiencing symptoms in their neck and also in the sort of mid-back area between their shoulder blades. The symptoms can be present during the night, which can disturb your sleep. And typically patients will feel very stiff when they wake up first thing in the morning, especially in the lower back. And these symptoms will often improve when they start to move, can be present for 30 minutes, but can be present for a number of hours. And individuals with axial spondyloarthritis will often mention fatigue, so extreme tiredness that they experience. Peripheral joint symptoms can also be something that patients will mention. So joints involving the knees, feet, wrists and elbows. These are less common than spinal symptoms, and also symptoms of enthesitis. So this can involve plantar fasciitis or the Achilles tendon, and also swelling of the fingers and toes, which is a condition called dactylitis.
No, absolutely. So what you've basically mentioned is a lot of the musculoskeletal, so the things that affect the joints and muscles. But what is really interesting, so some of our patients may not know, is that axial spondyloarthritis can affect the whole body pretty much. So we see, for example, about a quarter of patients with axial spondyloarthritis will experience inflammation of the eye, which we call uveitis. We will find that about 1 in 14 people with axial spondyloarthropathy may have inflammation of the bowel, and as such may develop a condition such as Crohn's disease or ulcerative colitis. We find that approximately 10% of our patients will have a skin condition called psoriasis. This will affect, for example, their scalp, their elbows, their knees. Not only do they have skin, bowel and eye involvement, they may also have problems with their lungs, or should I say the chest wall. A very common symptom is that patients describe tightness or stiffness around the rib cage, upper back and across the chest, which is usually due to inflammation of the rib joints or muscles attached to the ribs. And this could be quite debilitating and quite worrying for some patients, thinking this is all coming from the heart, but in fact it's just a bit of inflammation around the chest area. Small number, and I think this is quite a small number, do develop what we call fibrosis or scarring of the lungs. This is due to inflammation, which is usually identified when we do chest x-rays or scans of the chest as well. There are a few other areas that the condition can affect, for example, the heart. And finally, which is really prevalent or very common, should I say, is that approximately 60% of our patients will experience some form of mental health problems. So it is not just a condition that affects the spine or the joints. It is a condition that can potentially affect the whole body.
This podcast is intended for axial spondyloarthritis patients and has been initiated and funded by UCB Pharma Limited. Information contained within this podcast is not intended to be a substitute for consultation with your healthcare professional.